Hi, Stephanie Shaher from Bay City, Texas, and I'm going to talk about my journey traveling from Texas to Michigan to have Dr. Khan do my surgery. I met Dr. Khan through Facebook, and after watching, I don't know how many videos back in August and September, I was sold. I knew that he needed to be my surgeon. I had a suspected ruptured implant, and when I saw the videos of him cutting open the capsules of this, I think she was 70-year-old California woman that had both implants were silicone and both were ruptured, I was sold. I needed to have a surgeon who would make sure that I did not have silicone inside of my chest cavity. My rupture was self-contained in the scar capsule, and knowing that Dr. Khan was going to be my surgeon made me very comfortable, took away a lot of anxiety. It was the best part of this entire journey, was the relief in knowing I had a skilled, knowledgeable, trustworthy surgeon. And he had an incredible staff. They worked with me on all of the paperwork, and even when they had problems with my cardiologist's office getting my paperwork back on time, they advocated for me, and they called and they faxed and they emailed, and if it wasn't for them, I would have had to have rescheduled my appointment. I give them so much praise, going above and beyond. Not just him or his staff, but his surgical center also provides a calming environment. Nervous about surgeries, and I didn't want to be sitting there in, that hospital type setting. It seems like you're in a spa. It's decorated, minimal, yet very classy, very spa-like. And there wasn't a long wait. I didn't sit there and feel like anxiety building up, and his staff there, meeting them in person, was just as awesome as working with them via phone or email. And speaking of staff working with you, scheduling the appointment so that you spend minimal time in Michigan was amazing. So when they schedule your appointment, you have a pre-op on one day, you have your surgery, you have a day off, and then you have your post-op. They worked with us and set the times of the pre-op and the post-op so that you could also travel on those days. So in reality, we only had to be in Michigan Monday, Tuesday, Wednesday, and Thursday, traveling from Texas on Monday morning, leaving Michigan Thursday afternoon or evening. So you only needed to stay in a hotel 3 nights, which is great. A rental car for 3 nights, only 3 days worth of food. It all adds up, and they help work with you to help keep your costs down. Advice, I would say, make sure you get an extra breast bra and binder, so that when you're washing one set, you already have a clean set to put on. A good supply of button-up shirts, and nobody ever talks about the pants. I had loose yoga pants. I don't know if I could have pulled up tight yoga pants. You don't want to engage your chest muscles because of surgery. So you need loose pants that you can pull up. Slip-on shoes, because you certainly can't tie them unless I guess you can always depend on the person that's with you. Unless you travel alone, you're not going to be able to get your shoes on. You get the TSA paperwork that helps you go through TSA without having to raise your hands. That paperwork from Dr. Khan will also get you on the plane in the very beginning when they say active military and anyone else who needs to get on the plane early for medical reasons or whatever, please board now. And that's when you get on the plane. So the airport was a very nice experience. Houston airport's very crowded. TSA lines can be very long. In Michigan, it went very fast and swift, and there was no crowding or pushing. It wasn't overwhelming, and very nice, clean airport. If you do have a rental car, you do have to go off-site, but there's shuttle buses, and everything was very easy to find, and everybody was so very helpful. I don't know if they're so used to Dr. Khan's patients. They just went above and beyond and even helped me off and on the shuttle bus because I couldn't reach the grab bars, and my husband had 2 suitcases. So there were some things that I bought for post-surgery recovery that other women had recommended on Facebook. One of them was the mastectomy pillow, and I thought I would need that during transportation, like for the seat belt or in the airport with TSA, maybe get bumped or whatever, and it's still in the package. Never used it, never needed it, never felt like I needed it. Then the wedge pillow that a lot of ladies buy, happy I found mine on sale because, again, something I never used. Just used extra pillows to sleep upright in bed. And when you go to the hotel, make sure you get those pillows before your surgery. We didn't ask for them until the day after surgery. I don't know why. But again, get them before that. I had a Lululemon Crossbody, probably not the right name, probably pronouncing it wrong, but it clips on, so yeah, you could wear it as a fanny pack, but it works because of T-Rex arms. You know how you can't move them. Driver's license, pain pills, my migraine medication, the letter from Dr. Khan, my boarding pass, my cell phone, everything was right here, and I didn't have to worry about trying to carry a purse. You're on a 2 or a 3 pound weight limit, and most ladies' purses could weigh more than that. Anyway, it worked great. I didn't have to try to hang on to it on my shoulder, didn't have to have my husband hold it, was independent. If you're traveling alone, it's perfect. You won't lose anything. You won't put it in a pocket, forget about it, misplace it. And yes, I believe that you can do this alone. There was enough help. The only problem would be the weight restrictions. So I would say definitely check your bag. You're not going to want to drag that around the airport. You're not going to want to try to put it up above, get it back down. You can't. And you can always have somebody lift your bag off of the carousel for you. Definitely make sure you have one that has rollers, and pack as light as you can. Driving home from the hospital depends on where you live. I would not. I don't know if he even has a restriction on driving. I know people drive 2 weeks after surgery because they have to go back to work. I didn't drive until the other day, and only because I had to, and it was only a 10-minute drive. Anyway, if you have any questions, you can inbox me. I'm more than happy to share information.